Hello, everybody. I am Dr. Adil from United Kingdom. I am fellow of the Royal College of Surgeons of UK, and I've been working as a consultant surgeon with 30 years of unblemished medical record while working for the National Health Services of the United Kingdom. Today, I would like to take the privilege to address Chief Executive and Registrar of the General Medical Council, Mr. Charlie Massey, and Honorable Chair, Professor Carrie MacKewin, regarding numerous letters I had addressed to both of them regarding my unfair dismissal and prolonged suspension for the last 2.5 years. But unfortunately, I got no answer whatsoever, which has been extremely disappointing. At least I deserve to have some sort of response from these responsible high officials of the General Medical Council. I believe that I had done nothing wrong in holding my opinion and raising my voice against the novel coronavirus and unprecedented lockdown and extraordinary restrictions on the public, personal, and private life, affecting their economy, well-being, mental, and the physical health. The doors of the hospitals were shut. Millions of patients, especially the cancer patients, lost their opportunity for being investigated and treated. Thousands of elderly patients were transferred unplanned from the hospital to the nursing and care homes. And within 6 to 8 weeks, 78,000 elderly patients died due to dehydration, fear, isolation, and lack of the medical facilities. Similarly, thousands of people died in their own homes because of fear, depression, and other medical conditions as a result of heart attacks, pneumonia, complications of diabetes and hypertension, and stroke as a result of lack of medical facilities. Total reliance was made on the PCR test, which had very high false positive and false negative results, which has now been abandoned in UK, USA, and rest of the world. I felt sorry for youngsters committing suicide as a result of loss of their job, financial hardship, isolation, and depression as a result of lockdown. And I was right to protect my patients as a health professional who believes on the medical ethics, which is my fundamental duty as a health professional. I believe on Nuremberg Code as a wake of Nazi atrocities for performing inhuman, rather fatal procedures on the living human being. And I believe on the Helsinki's Declaration, which is an obligation on the health professionals to take the fully informed consent and the permission from the ethical committee before carrying out any experimentation on the human subject. And I totally believe on my Hippocratic oath, which says, first, do no harm. I believe on fully informed consent before carrying out any procedure. And I believe on total bodily autonomy of all the human being. I believe on robust scientific debate between the scientists and the clinician before starting any new medication or any complicated surgical or medical procedure to safeguard my patients. And I believe on face-to-face appointment with my patient to discuss the procedure, outcome, and the possible complications. Unfortunately, these procedures were not followed by the health authorities, regulatory bodies, and the medical establishment. And there has been clear violation of the human rights, civil liberties, and violation of the medical ethics, which is totally unacceptable. At the end of 2021, another move was made by the government in collaboration with the pharmaceutical companies for rolling out unlicensed, experimental, and untried vaccine with full indemnity to the public, which have now resulted in enormous complications from the embryonic life up to the elderly age, with embryonic deaths, fetal distress, abnormal growth, abortions in the mothers vaccinated with messenger RNA vaccine. And I have seen youngsters between 18 to 39 years of age dying because of sudden heart attacks, respiratory failure, pneumonia, and heart attacks. And various scientific research papers, publications, and the extensive studies across the world have shown that messenger RNA causes endothelial damage, which results into thrombosis or clot formation into the legs and the heart and the blood vessels of the lungs and the brain, resulting in deep venous thrombosis, pulmonary embolism, respiratory failure, myocarditis, and sudden death. Myocarditis is irreversible condition due to damage to the heart muscles, and stroke as a result of clots formation into the brain vessels. And recently, we have noticed the evidence of Bell's palsy, Guillain-Barré syndrome, dementia, and Alzheimer's disease related in the patients who had messenger RNA vaccination, which is a matter of great concern for me and millions of health professionals across the world. Many people have died due to sudden heart attack as a result of vaccination. There has been extensive survey carried out by British Medical Association, Medical Defence Union, and Medical Protection Society within UK in the recent past, which has confirmed that the General Medical Council has gone totally out of control, and its action towards the health professionals are totally vindictive, sclerotic, and overly bureaucratic. After receiving number of misguided, appalling cases against the health professional, the British Medical Association has called for a total overhaul of the General Medical Council and its Department of Fitness to Practice. And the extensive survey carried out by Medical Protection Society in UK, 75% respondent doctors have revealed that their referral to the General Medical Council has been extremely damaging, not only to their mental health, but also their physical health and the performance at work, which is extremely dangerous for our patients. Far from upholding the medical standard and safety of the patients and the public, the General Medical Council has failed to protect health professionals, and rather they have demoralized the morale of the health professional. And British Medical Council have revealed that the sanctions of fitness to practice are imposed on the vulnerable doctors, which are usually the doctors belonging to the ethnic minority and the locums, to send the message across the wide medical profession, which is totally unacceptable and threatening, and is not creating a good environment. The medical professionals within UK have totally lost their faith on the medical council, and they are convinced that in case of their referral to the medical council for any false and malicious referral would not be supported by the General Medical Council. So under the light of this submission, we need to have an alternate regulatory body to look after the health professionals, their well-being, our patients, and safety of the public. There has been quite a large number of deaths and suicide in long, laborious, and unending inquiry by the General Medical Council. The report published by the General Medical Council on 3rd of May 2022, GMC has admitted that from January 2018 until 31st of December 2020, there has been 29 deaths of the doctors during the GMC investigations. Out of that, 7 doctors committed suicide. Similarly, another report by the General Medical Council published on 14th of November 2014 has revealed that there has been 124 deaths of the doctors from year 2005 until 2013, and out of that, 29 doctors committed suicide during long and laborious, painful, and demoralizing investigations, and their families were ruined. The number could be much more than that because many cases have not been reported, or the families have left the countries. Recently, we had extremely tragic death of one of our colleagues, Dr. Michael McPhillips, consultant psychiatrist from London, graduated from Cambridge University. He committed suicide after receiving a threatening letter from the General Medical Council for starting an investigation on a minor complaint against him. The West London coroner, Dr. Anton van Dalen, has reported the autopsy results and have added that I have no hesitation in concluding that the information within the content of the General Medical Council letter contribute to the state of mind of Dr. McPhillips and therefore contributed to his death. This is extremely tragic for the family, friends, and all the health professionals across the world. This practice has to come to an end by the General Medical Council draconian, unlawful, and barbarian act sooner rather than later, before other health professionals end up into suicide with ruining their families. I would like to say at the end that one suicide of a doctor is the suicide of the entire medical community. Therefore, this is a time for the General Medical Council to reflect back and have an insight and amend your investigatory process to safeguard health professionals for providing the best possible services to our patients and to safeguard public. I understand the Medical Act 1983 is old enough, which needs robust reforms to safeguard health professionals and to improve the health services. By the Parliament. Until then, all the powers of the General Medical Council should be withdrawn for the suspension, arrears, conditioning, and warning to the health professionals, which is damaging to their morals and well-being, and should be passed on to the High Court for the justice in case of any dispute among the Medical Council and the health professional itself. With these words, I'm most grateful to all of you for listening to me, and especially the health professionals who are responsible for acting upon their medical ethics. Many thanks. Bye for now.